welcome back to the Healthtech Pigeon podcast, where we bring you the TLDR on all the latest health tech stories. I'm joined today by my co-host, Amy Thomas, and we've got a lot to talk about today, haven't we, Amy? How are you doing?
It's been a busy week this week, but yeah, I'm doing very well, and nice to see lots of news going on. We've had lots of events we're going to. Feels like a very busy time for health tech events. So yeah, I was lucky enough to be at South by Southwest last week.
Jill, tell us all
Yes,
about it.
it was fun. It was
Was it
obviously
star-studded, celebrity-packed,
that's
obviously science-packed? We saw some excellent science on stage. Shout out Quinn from Oka and his livers.
Yes, I concur. It was a great talk. Well, that's what I was hoping for. I was so we had the platinum passes. I was ready for the celebrity parties. I was ready for schmoozing. I was ready for meeting my favorite music artists. But there was less of that than I had imagined. Although I did get to see some music, and I ventured into I forget the name of it. It was like a crypt kind of club,
Oh,
and then
cool.
actually saw someone play who I'd done a set with a few years ago. So yeah, that was quite fun.
Wow.
And then ended up in a club, like a full on club, at one point. But yes, the science was also good, and yeah, Oka's talk was fascinating, and we had on stage the machine that pumps the livers with oxygen. So that was a whole ordeal in itself to have the machine on stage. But there was also some really interesting talks, and it was cool because they were quite short. So
Mm.
you had
How short is short?
20 minutes.
Nice.
Yeah, so it was like a quick kind of whistle stop tour of,
Mm.
key headlines, key points. Um, I loved it. The one before Oka was about mental health crisis of young people right now, and that was super interesting. And there was a leading neuroscientist and clinicians there talking about essentially how do we treat this and what is causing it. A lot of what they were talking about was technology related in terms of social media, but yeah, it was really interesting to hear them talking about it through like a medical perspective. But yeah, I do encourage people to go and check out some of the talks and science stuff like on the website and see if they can catch any of it because it was pretty cool.
Awesome. I mean, well, for anyone who doesn't already know, Amy is actually a musician in her life outside of health tech and SomX. So I have every faith that she won't even need a ticket next year. She's going to be on stage. So I'll be there to fangirl you, that's for sure. And I'm sure the rest of the team will because they are absolute fans of yours. And it's always nice to see people doing things outside of health tech. And actually, I think it's really cool what you were saying there about the fact that you have like some really deep science that is being brought to like, such a broad audience in such an accessible way, alongside, we joke about it being star studded and packed with celebrities and all of that kind of thing. And perhaps it wasn't quite to the extent Instagram would have us believe, but it's really cool to see that in amongst lots of other cool, traditionally sparkly, exciting things that lots of people would be paying to go and see already. And I think we need more of that. I think we all operate in silos, don't we? And it's very easy. I do love our health tech bubble, but it is nice to venture outside of that. So I think South by Southwest is a good example of maybe something we need more of. I'm not sure I would make it to the club. I'd like to, but I'm short on sleep at the moment. But maybe by next year I might, of course, have enough to join you.
No,
Um,
what baby Levi doesn't like the club?
do you know what? He's actually a big fan of house music and a really strong bass line. So I think if anyone's going to be there, it's going to be him. Um,
Without you.
yeah, yeah, probably. And then
Yeah.
I'll be doing the mum thing like, "Come home, where are you?" Um, yeah. Or no, maybe I'm not like regular mums. I'm a cool mum, and I'll be there with him. Um,
Ah.
Anyway, we've really gone down rabbit hole pretty quickly. But some other events that have been going on, we had the Google Cloud Healthcare and Life Sciences Tech Forum last Friday. It was packed out and I was genuinely shocked by the number of people we had in the room for a Friday. It was phenomenal. We had such a great day hearing from companies like Isomorphic and Giles AI. We heard from Latent Labs, so many different companies, all doing different things. And we really went on a kind of journey of discovery, starting with some quite kind of deep and technical science, which again was brought to us in a super accessible way that helped us really understand where we're at in terms of how AI is influencing drug discovery and how we're using basically machines to create medicines now. We then talked about technologies and the data. Importantly, the data. You can't have a conversation about AI without the data, and how we're creating or making sense out of data chaos. And then we finished the day with Benedict from Sonome and Nikita from Anira, who were telling us all about how basically they're using AI to make clinical impact for patients, and clinicians at the point of care, which was super cool. So we kind of went, as I said, that full arc all the way from molecule to person, and like impact in real life. And it was great. And there was pizza. So that was a fun one. Um, and there's been London Tech Week this week. That has seen a little bit of controversy. We can't lie. Or not that we can't lie. We're not lying. But we can't avoid the headlines. And something that's particularly pertinent to me and my current situation was I feed the intern as we podcast. But I don't know if anybody saw there was a mum who had driven 3 hours with her 8-month-old, and for anyone who knows, just doing that is a feat in and of itself, to attend London Tech Week. So 6-hour round trip, only to be refused entry at the door, which obviously is pretty awful. And then the response from the organisation was ultimately that the event is not set up to accommodate the needs and safeguards for babies and young children, which I would suggest maybe not handled super well, and obviously something that I'm really passionate about because I just think that working mums need a break and everyone's just out there doing their best. And for some of us, much like me, like the woman who attended that event, it's not an option to be separated from your child. And actually, if you're working, you have to be able to bring your child with you. And yeah, it's just
As a mother, what do you think could have, like, what information or like what would you need to kind of improve that situation in the future? Is it that, companies need to say this is a child friendly, like you can bring your children, or it's just the fact that they should not turn people away on the door? What do you think?
yeah, I think just letting her in probably would be a good start. Um, but that I think there has to be accommodations. Maybe it's not. I do think there should be accommodations made. And my position on this has really changed since having a child because I really feel like a veil's lifted. Um, and actually how difficult it is to work and be a parent at the same time and do those both concurrently. And simple things that you can do to help people. And actually, this goes for people with, additional needs and disabilities, helping them to physically access places, but also make that experience a really positive one for them. And obviously, everyone knows it's Health Next Week, and we'll come on to talk about that. And some of the things that I'm excited about there, but they have really gone above and beyond in really supporting me because I'm going to be tending alone this time. James is off to Cannes Lions, the bright lights, the south of France, while Levi and I take Amsterdam. So I'm a little bit nervous, and they really have gone above and beyond to make me feel comfortable. As far as I'm aware, I'm the only parent going with a child in tow, and they have found me space to feed if I need it, and have just asked at every turn, it's like, what can they do to make my life easier, and just been really encouraging and supportive. And I thanked them, and they said, "Don't thank us because we're doing this as a bare minimum." And I think that like, event organised should take heed of that. And you don't commonly see children and babies in these spaces. And maybe there are limits where, it probably wouldn't be optimal having 3-year-olds running around whilst you are trying to have business meetings. I totally get that. But a babe in arms, I think, is different, because often you're at a point where they're not in formal childcare, and often you don't have people around you who can support you with childcare needs as well. So, um, I actually just think a little bit more empathy would go a really long way. Um, and it could be also a simple case of, the security team just weren't well enough briefed. And often in situations similar to that, you might err on the side of caution and just say, "Would you know what? On this occasion, probably not the place for a baby." And I think, yeah, briefing event teams, and finding ways to support people who have different needs, and that's beyond simply just mums, um, to be able to go and participate in those spaces,
Yeah.
and be active at
Mm.
events.
It's quite positive that the story got coverage, in the media. I think it shows that people are, they're not okay with it, and, like, that narrative is
Mm,
hopefully get a trickle down so that these things
mm.
don't happen again, and we just make it easier for mums and babies, because they
Yeah,
are a valid part of the ecosystem.
you're so right. I actually think that whilst a horrible experience for the lady who had to go through that, with all the coverage and all the rhetoric that has come with it, I think it's been incredibly positive because what it's shown other women that you can do it. I think it's given other women permission to do that. So, and dads as well, I'm sure James will be in similar situations where, he has our child, he has Levi, and he needs to go to a business meeting or he goes to an event without me and all of that kind of thing. And so, any kind of parent or carer, I hope that just by being visible and knowing that there are people who are showing up and doing those things gives other people permission to do it. So I think it's brought an important conversation to the surface, which is awesome. Anyway, enough mum talk. Let's talk about health before we go on and actually talk about news because everyone's talking about health. We can't escape it. I think everyone's been talking about it since the Survivors Barbecue last year, um, in Amsterdam. So, oh yeah, I'm also excited. Levi's also excited. He's currently sleeping, but he is excited. He told me. And I just want to give a bit of advice for anyone who is a first time healther because it is big, it is bright, it is bold, and it can be a little bit overwhelming. But it is phenomenal. And my 4 pieces of advice for anyone who was going is first of all, tell everyone you're going. It sounds really cringe, but post on LinkedIn because there are lots of people who will also be going who will see that and reach out to you, and you'll end up with catch ups with people you've been meaning to chat to for ages or you haven't connected with for a while, people who are just interested in talking to you perhaps that you didn't already know. And there's been a lot of that. So I definitely advocate for shouting about the fact that you're there. I really recommend their app. Lots of conference apps are a bit rubbish. The health app I found pretty useful last time. And actually the messaging function for setting up meetings with people was great. I wouldn't say it's 100% hit rate, but it's a really good opportunity to reach out to people who you've been wanting to talk to for ages.
Mm,
So definitely utilize that and you can curate your own agenda, which is cool.
that's great. And one note on apps for conferences is that
Mm.
an additional benefit I realized is if you're meeting someone and you don't really know what they look like, or like their LinkedIn photo is really old, sometimes it can be really help
Mm,
to spot them at the conference, to just
such a good point.
yeah. And when I was at South by Southwest, they took a picture of me there for my badge, and so I was in the outfit that I was obviously wearing on the day, so then people, it
Oh,
was
okay.
easier for them to spot me as well. So yeah, just a little
Nice.
practical benefit, which was great from using an app.
Yeah, that's a very good case, people, for making sure your LinkedIn photos are up to date.
So
I am a
people
culprit because mine is definitely from like 2021. I have totally different hair. I mean, I would like to think I look relatively similar, but I don't know if I disappeared one day and it went out to the press, maybe you wouldn't recognize me. But still, yeah, make sure your photos are up to date so that people can recognize you. That's a good bonus tip. Thank you, Amy. Um, I would also say don't don't fill your calendar. the content is super impressive, really valuable. There's lots of great conversations that happen on stage, but there is so much of it, and it's impossible to get around everything. Not least, it's impossible to get around all the things that you think you're gonna get to. So, I would choose, like, 2 or 3 things a day that you definitely want to get to, but leave loads of gaps in your calendar, because what I found was the best thing about being at Health with I all the serendipity, bumping into people as I was actually walking to a session that I wanted to go to and then missing it altogether because I ended up just having a really good conversation, bumping into people in lifts or just getting talking to people in lifts that I didn't know, that I ended up going and having a meeting with later in the week. Um, and making sure that you attend not all of them, if you're anything like me, your social battery would need recharging, but attend the social occasions as well, because I think often that's where you build relationships, and that's what this whole game is about, isn't it? It's about relationships and figuring out how we can support each other. So I would prioritize those over making sure that you have like a content heavy day. You want to make space to be able to meet people. And that is 100% where you'll get the most value. And the content is almost a bonus in my mind. So there you go, 5 things. Tell everyone you're going, download the app and use it, don't fill your calendar, and yeah, don't give yourself a hard time if you miss things, because there's so much going on, and make sure your LinkedIn photo is up to date so everyone can find you.
One more question on Health. Have they revealed the band that's playing?
Actually I haven't seen that they have.
Oh.
I'm kind of hoping for Snoop Dogg or the Spice Girls. That would be cool.
It's
The
gotta
Spice
be
Girls, could we petition for the Spice Girls?
we could well, yeah, we
Oh,
could.
Amy just did a thumbs down. She's not keen on the Spice Girls.
That came out of my head as well. That was almost for those of you just
It read your mind.
for those of you listening, a bubble just appeared above my head with the thumbs down. So yeah, apparently I'm not a fan. But I
Beyonce's on tour. It could be Beyonce.
that would be epic.
It would be epic. Bring your cowboy hats. That's the 6th tip for Health. Bring your cowboy hats just in case.
Well, lots to look forward to.
And with that, why don't we talk about some news? Our first story of today. There are 2 big things that have been going on, certainly in my world. There's lots of stories in Pigeon, but there's 2 big things that we're going to talk about today. The first is period tracking apps. There's been a lot of chat about period tracking apps actually this entire year, maybe even longer. I can't remember when Flo did their massive raise, but even before then, we've been talking about it. Roe versus Wade, obviously, lots of controversy around legislation relating to women's rights over their womb and its contents, and also the rights of legislators, lawmakers, and police and all of that kind of thing to be able to access personal data to potentially prosecute people for choosing to terminate pregnancies. And Flow had a massive raise. They were one of the really big, not just success stories in women's health and femtech, but actually in health tech in terms of raises. So really phenomenal valuation, becoming a unicorn. Um, but with that has come some controversy. Um, so Flow themselves have been caught up in some less positive news stories at the moment, where we've seen some class action lawsuits over in the US and in Canada around how some of that data has been used and maybe crossed uh, cyber borders, shall we say, into the hands of Meta, for example. And so the story this week that we are going to talk about is here in the UK, public health bodies are being urged to launch their own period tracking apps in order to protect data. And because there are these concerns that women's information is at risk because it's being harvested by private entities and being sold in ways that users are not aware of or have not given permission to. And I think obviously there's been a lot of discussion even recently around how I think I saw a headline around how police are being given training to access people's phones and look at period tracking apps and that kind of thing. as they investigate cases where there may have been, as it stands, unlawful terminations. So, yeah, super interesting. I think, the um, public sector organizations don't have a great track record of building successful tech themselves. Um, but I think this is a really interesting approach and has raised a lot of questions. So, Amy, what's your take on this?
Initial initial reactions, I suppose, I mean, there's so many things in this, but on the topic of public bodies, um, taking a hold of that or taking charge of that responsibility and providing a technology that potentially is safer, for women, it's a great idea, and I think it the I it 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 brings us back to what public bodies are there for. In a lot of cases in the UK, they are there, especially, some of the public organizations that are slightly more independent from the government, let's say, set up to be that kind of non-biased, independent, source of trust and truth. We have it for drug approvals, medical approvals, guidance, like the National Institute of Health and Care Excellence. They're there to kind of provide that overall guidance where it's a trustworthy source. And I think there's a need for it here so much. How it actually happens, though, I mean, I think it's totally possible. I mean, the NHS app is doing some great stuff lately with adding new features. Just recently, they added the prescription delivery service, like Amazon style. So it is totally possible that it could happen. I think it's just about that competition that we've got from other period tracking apps. But clearly, as an instant reaction, obviously it's a very worrying problem, and I think particularly at the moment where my concern is also for young people, a lot for young people, because we s- there's a lot of obviously technology first, tech first focus at young people, and they are particularly vulnerable to messages on social media, and we've seen that rates, especially in young people, mental health and all of that. It just feels very like a very vulnerable position that if we don't kind of target it now, there could be some quite detrimental results where, let's be honest, companies will capitalize on it. They will capitalize on the data. They'll take it and they'll market. My friend who works at Wellbeing of Women, women's health charity, has been doing work in this area, and she explained to me the kinds of campaigns that advertisers are doing, um, and it is as specific as targeting women in specific phases of their cycle with specific products. For example, in your luteal cycle, they will target more homeware products, or when you're in a certain phase of your ovulation, targeting sexy underwear ads.
What?
So we have
Oh, I
got
had no clue.
it's got to such an extreme. It's actually making me a little bit riled up talking about that. Such an
Levi's upset. He's crying.
yeah, such an
He's not okay with this.
such an extreme point of manipulation that is. And
Crazy.
given that we have, like, consumerism obviously is rife, but particularly for women, there are so many products targeted at women, more products targeted at women than men. We know that, and it just feels particularly vulnerable. It's something that we do need to desperately address, because who's going to profit in the end?
Yeah.
It will be not young, vulnerable women. It won't be.
I find so distressing about that as well is that I feel like we've been riding this wave of women having more information about their bodies, better understanding their bodies, empowering them in their own health and being able to make decisions about their own health and their lives. And hearing something like that, to me, is snatching that away. It's snatching away the progress that we've made to control women again. And let's not lie, advertising is psychological warfare. Um, and when advertisers, when commercial entities are able to target you with such specificity on that very personal level, I think that's frightening. And I guess one of the things that really terrifies me as well, and you rightly talk about young people, is they're being brought up in a digital economy, and they're being brought up, most of them, their parent probably have been posting photos of them online since they were small, since they were born. Um, and they will have potentially had access to social media really early because that is really normal. And so I think I don't want to say it becomes a slippery slope, but I think there's much less friction and far fewer barriers, or even like checkpoints that make you stop and think, should I sign up to this? Or what am I signing up to? Or how is my data being used? Because also, if you have young children, and don't get me wrong, I'm very well aware that Meta is saying children under 13, whatever it is, shouldn't be on there. They are, and they know that. And I still think that that's being leveraged. They, children of 13, 14, 15. I think back to when I was 18, I was not equipped to be able to even comprehend the consequences of these kinds of decisions, and I'm grateful I didn't have to make them. I think I got Facebook when I was 17, 16 or 17, when it was like, it wasn't cool. I was like one of the first people at school to have it, and everyone was like, "This is a bit weird. What is it?" Before it was a thing. Whereas now, it's just synonymous with life. It's part of life. It's a fact of life. And yeah, terrifying.
Something also about the it's difficult because it is that the the information which you give a period tracking app is extensive if you're using it properly, not just about when your actual period is happening, at what stage, your symptoms, even documenting your feelings and thoughts and encouraging that kind of sharing.
Which,
It's
let's face it, most people would not share with another human being.
right. And I it's just feels like such a slippery slope, like the data, what that could be potentially used for in terms of vulnerability, targeting, and yeah, it's something I feel really passionately about actually is how especially women and just generally young people and the, that 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 vulnerability that we have online of what we're seeing with ads, because I see myself getting sucked into things online, and it just feels like we're not privy to the manipulation, but it's subtle. It's very subtle, and what that's doing at a population level of changing small behaviors over time is extremely worrying, and particularly in regards to sexual health, it's a personal thing. It's just yeah, it's laced with all sorts of very uncomfortable feelings. So if there was a way to get out of it and improve the transparency, but whether or not people would come off their private, are they going to switch onto the NHS app if it's not as
Mm,
slick
mm,
as the one they're currently using? Um,
mm.
or is
Well,
it that
I have two views on this. Not views, but two, like, thoughts on this. The first is the conspiracy theorist in me, and I spent a long time at university watching YouTube videos about why Michael Jackson was still alive. However, I have vaccinated my child. But the conspiracy theorist in me, so I guess, like, let's flip the coin. The conspiracy theorist in me is like, we talked about commercial entity here, and how people can be manipulated by their unwitting sharing of their data. So what we've also talked about, I mentioned Roe versus Wade. I mentioned how there's been recent headlines about police officers being shown how to access people's phones to receive or to access information about their menstrual cycles, pregnancy, etc., etc. To be honest, they can do that. They may as well also just check WhatsApp because I if I thought I was pregnant or if I'm having a bad period, the people I'm telling, well, where that information is getting shared is probably more likely to be in WhatsApp than it is in in an app. However, if a public sector organization was to create a period tracking app, they're the law keepers. So they're the ones who, and I appreciate that it looks like some legislation might be pushed through to the contrary. In the UK, though, that's in the UK. So if if a government entity was to create a period tracking app and there is legislation in place that could see people getting prosecuted for taking action on their own health, regardless of how you feel about that, ultimately that data is in the hands of the government already. So then you're in a situation where you are damned if you do and you're damned if you don't almost, because you go to a private service and they could be selling your information to commercial entities. You go to a government service and it could leave you vulnerable to facing legal consequences to decisions and actions that you took about your own health and your own life. So, yeah, that's my first
Mm,
point. So,
mm,
on that, Amy,
mm.
where do you stand on that? What do you think is the lesser of the two evils?
I guess at the end of the day, someone holds the data. Someone holds it, and there's always going to be a power in that. And whether the risks of power from government decisions versus commercial decisions, I suppose it's what are the worst risks? Um, is it that we get targeted for ads, or is it something? Is there other risks of something more? I was about to say something more serious, but I don't even know if I can say that. Legal legal consequences. Um, I think it's it's an issue that extends actually beyond women's health. It's about data and how we collect it and where it gets used. And I think we where we are now with how we've rapidly adopted technology and how we're trying to, we have all these conversations about why we need to, and we would we'd be at the forefront of championing that. But the law can't keep up, and the regulations can't keep up because it's happening so quick. So who holds the data? Where does it go? Who's protected? Who's most vulnerable? These are questions that are so key. And perhaps it's that we need more research. We need more people working on these policies. Like, people are working on it, but are they working on it as much as everything else? I'm not sure. That was a rounded answer to your question, but I think it's about understanding who's most vulnerable, and I think it's about protection, and at the same time not stifling the progress. Um, Maybe it's also about encouraging people to be aware, because if we can't regulate everything, which we can't, it's encouraging to people to have these kind of conversations of, what you're doing, and therefore you can be more attuned to what you feel comfortable with. Some people don't care. They're like, have my data.
Mm,
And some people do.
mm.
Um, yeah, it's I
I think there's no simple solution. It kind of feels like you're stuck between a rock and a hard place. However, I am delighted to say I think I have the solution, and that's a very bold statement because it's actually not me who has the solution at all. I'm really taking credit for some other people's hard work and innovation here. But I have seen at least two, potentially more, but definitely two, and one that I know of well. Um, Solution providers, so period tracking solutions that are thinking about how to do things differently and basically creating infrastructure, which means that the data is only stored on a person's device. So the person actually owns their own data. So it doesn't actually get shared to any cloud. It doesn't get shared with the government. It doesn't get shared with a commercial entity. They own it. And it's encrypted. And they can also make decisions about how that data gets used so they can be paid to share their data. I think I talked about 28X on a previous episode where apparently, I will repeat this fact because it still blows my mind. Period blood is more valuable gram for gram than gold. So you can donate your period blood for medical research and get paid for it, basically. And you can share your data and you can get paid for it, or you can choose to donate that money to charity and that kind of thing. So, what I think these challenges that we've seen has done is push people to find culturally sensitive, appropriate, and empathic solution where people can genuinely get and hold their own data without having to and be able to have that information and make sense of it without having to share it. Now, as I said, I've seen in response to this story, I've seen Amber from 28X talk about it, and I can't remember who else it was, but definitely one other alternative, at least it's not two, that are looking into how to utilize this technology, which I guess is like decentralized data storage, isn't it? And I suppose we've seen examples of that with, I want to say like uh, crypto and Bitcoin and all of that kind of thing, but that's not quite the same thing. That's not a very good example. But like where we talk about the decentralized web and those
Mm,
kinds of
mm,
things, where ultimately there's a pod where a person's data sits, and then they can grant access to places to access it, but it's in a very intentional, clear way, so people know that they're doing it. It's not almost like a subconscious, just as I do
mm.
every day, I still do, click yes to the terms and conditions, even when I'm booking a table for a restaurant.
I thought of an analogy.
Go.
Maybe this is a very simple one, but this is what popped in my head. You know when you click private browsing mode on your
Yep.
web, okay?
Yeah.
Maybe there could be that kind of system where
Yeah.
you have control of like, no, I don't want this data to be fed into anything. I'm going to go in
Mm,
private AI mode or whatever
mm,
it is. And I know that I'm sort of protected. It's not going to track
mm,
my history. It's not going to, track my cookies or like, whatever. Giving people that power and transparency and control. And I think, but it's tough. It's tough to do that on top of everything else of like,
mm,
this stuff's complicated, and
mm,
but it's possible. They've
mm,
come this far in developing the tech to
mm,
just add that layer of protection and transparency. It needs to be considered,
mm,
and people are,
mm.
but not everyone.
Yeah. I think the difficulty is with this stuff, though, that it requires a different way of um, financing it. I think that's often the difficult thing, right? Because you have so many VC-backed companies. VCs are looking for return on investment. There's a commercial drive, and so I think when people are then being given the option to turn off their data, everyone talks about data being the new oil and gas. So, if people are turning off their data, then the abundance of data is getting less, and that's what's making money. So there has to be new commercial models for funding and also bringing in revenue, which I think is what 28X actually does very well. It's completely rethinking that, but it's also coming from a position where they've been fortunate enough to they're not going from a standing start because Amber is a second, I think at least second, probably more than that, second time founder and created and exited the Pregnancy Plus app, which has compares your baby to cakes, animals, and fruits. And she exited that to Philips. So she's been there and done that. And yeah, it is kind of it's not a cheat code because she worked very hard on that, but she's not going from a standing start, is what I'm saying. Uh, and it's not her first rodeo. And I think it's very hard if you're bootstrapping, for example. Bootstrapping is not an easy thing to do. And not always possible. So I think what we need to see is also new ways of the new financial incentives, I suppose, both for the users but also for the commercial entities, so that they can because they do great things. And I am not going to bash Flow because I've had good experiences with them. I have used them for many years. know people who work at Flow, and I'm very, very fond of them.
Mm,
And I don't think as an organization they're a terrible,
mm,
organization that sometimes they are tainted to be. However, things have gone wrong,
yeah.
unfortunately.
And I think there's a difference in the product versus the other consequence. Like, you can have a great product, like Flow's product is great. I've used it myself and it's fantastic. It's that other layer. And yeah, the finance question is, it got my brain going in all sorts of different areas, actually, just about ethical finance. Like,
Yeah,
what
yeah.
what we place our economy, our financial gains are in GDP. That's what we measure it on. Um, but it's not, GDP is not an indicator of human happiness, well-being, or health. So I think there's a fundamental disconnect. And that's a much bigger question, which could probably be a whole nother podcast, to be honest. Um, but there's something interesting about that. And our VCs that we work with, that there's work on this of like, how do you incorporate ethical principles into the finance structure that makes both financial returns completely possible, as well as a good, sustainable health and economy system. It is possible. I think it's complex and people don't talk about it, and actually not all VCs consider them. Not they don't. Um, but a very interesting area, and I think, yeah, definitely something we could talk more about. Maybe there's another episode somewhere on that.
Yeah, there isn't I don't think there's a clear blueprint for it, but I think it's an important conversation that we should have, and I think it's a conversation that we should have right here on this podcast and also on the Health Tech podcast too, because I do feel like we're at a crossroads. And there's a lot of debate around it too, and I think I want to hear that debate. I'm not w- well enough informed to be able to participate and
Mm,
hold a particularly strong view,
mm,
other than I just want people to be kept safe, and for us as an industry to be able to continue having phenomenal impact. And I guess with that, I wanted to say this takes us on to our second story, but I think we are at the top of the episode here because we were going to talk about the spending review, but we've got so fixated on our excitement for events and ending up in the club, and period trackers, which I think is one of my favorite topics because I always find a way to talk about women's health whenever I come and sit at this microphone. Um, but what I will say, my commitment to listeners is we will talk about spending review, and I'm going to be doing some interviews with people whilst I'm at Health next week. So I will be looking to get some hot takes on what people think the spending review might mean for healthcare, for technology, and I guess temperature check on how people are feeling. Is it a positive thing? Is it wholly negative? Are people kind of somewhere in the middle? Is it a bit lukewarm? We'll find out. Um, but yeah, I think we went to town on period trackers today,
we
and
did.
I thoroughly enjoyed it. So thank you for joining me on this escapade, Amy.
Oh, thank you for allowing allowing that. Yeah, no, it's been a great chat, and sorry we didn't get to spend the spending review, but we will, I'm sure, get to that very soon. And yeah, thanks for allowing us to chat passionately about this area, because it is super important and raises a lot of interesting questions beyond women's health as well. So yeah, interesting.
Agreed. And I do think it's a story that will continue to unfold and we will continue to talk about. I'm quite interested to actually see the industry response to this move or this call, shall I say. So fear not, we will continue reporting and sharing our views as they evolve too. So thank you, dear listeners. This isn't Bridgerton, sorry. Uh, Thank you, dear listeners, for joining us on this week's episode. Sorry it's been chaos with a really intern and the journey we've been on with the stories today and the events. But I'm excited to be back next week sharing our experiences of everything we get up to out and about next week and bring you some more news stories. So have a great weekend and see you again next week.
Bye, everyone. See you soon.